Hello viewers, you are watching me Zakur Islam, and today the topic which I am going to present, that is 5-HT3 or 5-hydroxytryptamine antagonist, serotonin receptor antagonist. Mechanism of actions of hydroxytryptamine, so it can inhibit the nausea and vomiting by blocking the afferent vagal nerve terminal and the upper gastrointestinal tract, and also serotonin receptor and the chemoreceptor trigger zone. So for examples, ondansetrons, which are available in a market by trade names of France, while another one is granisetron, so which is also available in a market by trade name Ketrel. The adverse effects which are reported in the literature by hydroxytryptamine, so that is sedations, dry mouth, blurred visions, and urinary retentions. An adjuvant antiemetics, these drugs help an enhancement of other antiemetics. For example, dexamethasones, which is available by the name of decadron, benzodiazepine, for example, lorazepam, and cannabinoids. Substance P are neurokinase 1 receptor blockers, so that is apripatents, belongs to new family of antiemetic agents, so it targets and blocks the neurokinin receptor in brain. Neurokinin is a neurotransmitter that transmit the signal from the gastrointestinal tract to the neurokinin receptor located in the reflex center. The side effects which are reported after administration of these agents, so that is constipation and fatigue, appear to be the major side effects. Come toward the nursing care to antiemetics. So first of all, you will have to take history, then check the hepatic function and renal status prior to therapy. Monitor vital signs and input or outputs, then skin targets elasticity of skin, or you can say the flexibility, or you can say the elasticity of skin. Advise the patient and family to use non-pharmacological measures such as for example, avoid non-greasy meals like fast food, provide oral hygiene, and remove the noxious stimuli from environment. Give antiemetic free meals. The drugs may cause drowsiness, so instruct the patient to call for assistance when ambulating. Avoid activities, for example, driving and other that require alertness. Instruct patient to change position slowly to minimize orthostatic hypertension. Antiemetics are avoided in patients with eye problem and women in first trimester of pregnancy. Antiemetics should be avoided with alcohol ingestions. Emetics drugs are those drugs which are used to expel the toxic substances before absorption occurs. Pharmacological actions of emetics, it stimulate the chemoreceptor trigger zone, which act directly on the gastric mucosa and stimulating vomiting. So in the absence of emetics, it stimulates the oropharynx with the finger. Response of vomiting center is directly on the smooth muscle of intestine, through which contractions start and small intestine and then move toward the stomach esophagus, which result in expel of material through mouth. For examples, the classical examples that is apicox syrup used in clients who are allergic 60 minutes of poisonings, and charcoal absorbent or gastric lavage. And these drugs are contraindicated, especially in unconscious or infants. The side effects which are reported, that is in the form of dehydrations, vomiting, headache, drowsiness, CNS effect, and hypertension may be occurs. Now these are the drugs especially which are used in vomiting, so that is emetics, drug used to induce the vomiting, rarely used except in poisoning. It includes the central acting emetics, and these drugs directly work on the vomiting center on the chemoreceptor trigger zone, and it stimulates the vomiting. For example, apomorphine and morphines. So I mean, it is not necessary that a single drug can be used for a specific treatment. So there are multiple indications of single drug. So peripherally attacking emetics in these drugs directly go into the stomach irritated to cause vomiting. For example, hypertonic saline and mustards. Centrally and peripherally acting, these drugs act on both vomiting center and stomach and cause vomiting. For example, syrup of Epicoc 15 to 20 ml. So this is very easy to understand. You can see here, this is the drugs, these are contraindications, side effects, and nursing responsibility. So this is very easy. Drug is apomorphine and morphine. So they are contraindicated in unconscious childs and pregnant women consumption of corrosive acidic or petroleum products. The side effects, they are reported in the form of sedation. Overdose may cause restlessness, convulsion, and respiratory depression may be occur. The nursing responsibility is in case of overdosing. So antidotes, they are available, that is nilorphins, or you can say chlorpromazine to suppress the vomiting. In case of hypertonic salines, hypertensions, it is contraindicated. Hypertonic saline is contraindicated and hypertension. So if vomiting doesn't occur, salt poisoning. So these are the side effects. No immense stomach evacuate through tube. Epicoc syrup 15 ml. Repeat the dose after every 20 minutes. Drowsiness and lethargy may be occur, but it should be avoided in infants. Nursing care to emetics determine the nature of the poison taken. Do not induce vomiting if the poison involved in corrosive or petroleum nature or in clients with absent gag reflex. Administer Epicoc with full glass of water and then teach the families about the proper storage, such as keeping it safe and away from kids. Thank you so much for watching my lectures. So inshallah, in my next lecture we will discuss about the anti-ulcer drugs. Thank you so much. So if you have any question regarding my lectures, so all these lectures are available in soft form, so I can share with all professional and healthcare profession. Thank you.